What is the secret to solving your neck and back pain? Neck and back pain are very common, and in today's society, so are the treatments. If you go online or watch TV late at night, there are hundreds of different solutions, from magic braces to pills to creams to devices. Also, if you talk to your neighbors, your friends, different people you meet, everybody has a solution that can help. And even in the medical community, there are differences in terms of how neck and back pain should be treated. So, as patients, it's very difficult to figure out what's best. Now, there is a system that has been in existence since about the 1500s. People like Rene Descartes and Copernicus and Galileo helped develop this system of thought and treatment. So we have a problem, let's say low back pain. We come up with what we call a hypothesis, and then we test it. So there's a problem, we come up with a potential solution, we test it, and then we come up with conclusions. For instance, if I have low back pain and I think that acetaminophen or Tylenol is going to work better than Gabapentin or Neurontin, I go through a whole series of experiments. It's called collecting evidence. There are whole institutions and rules on how this has to be done, IRB approval, but essentially you can do multiple studies, blinded, placebo-controlled, and a whole science behind that. But the idea is to collect reproducible evidence that helps us come up with a solution. And then, for instance, we find that gabapentin or Neurontin works better with sciatic pain or nerve pain. We have a treatment for nerve pain. So this method of thinking, called the scientific method, or rationalism called the scientific method, or objective way of coming up with solutions, is the best way to treat neck and back pain. And again, there are limitations to this, but as a generalization, that's what we look for in treatment. It's called evidence-based treatments. In today's society, as patients, you have access to all this evidence. Go online, go to different resources, and evaluate the evidence behind any treatment, and use your own judgment.